Good afternoon, everyone, or good morning to some of you on the West Coast. Thank you all for joining us today for this webinar. We're excited that all of you will be attending our meeting next week for our national strategy discussion, organized by APCHO and the Health Forum, hosted by the Aetna Foundation on the 15th and 16th. And the purpose of our webinar today was just to make sure that everyone who's coming to the meeting next week will have a good foundation, some basic knowledge about the health insurance marketplace, some of the consumer assistance programs. We're going to talk about the role of consumer advocates in the community health centers, and also touch on some of the barriers faced by the AA and NHPI population. My name is Ian John. I'm a policy analyst here at the Health Forum, and I'll be moderating the discussion today. So we have 4 speakers, and I'll introduce each one briefly before their presentation. Just to let you know who we have here today, we've got Anton Gunn from the U.S. Department of Health and Human Services. He'll be providing an overview of the health insurance marketplace. Quincy Nguyen from Community Catalyst will be talking about the role of consumer advocates and talk about some of the different types of consumer assistance programs. We have Dr. Andrea Karakostas from the Hope Clinic in Texas, and she's going to be talking about the role of the community health centers in outreach, education, and enrollment. And then I'll be also speaking about some of the barriers facing the populations that we are targeting. So from what I'm going to do now is turn it over to Anton, and I'm going to give just a brief introduction for Anton Gunn. Anton is the Director of External Affairs for the Office of Intergovernmental and External Affairs at the U.S. Department of Health and Human Services. He was appointed to that position by Secretary Sebelius in 2012. And before that, he served as a member of the South Carolina House of Representatives from 2008 to 2010. In 2010, he was also appointed by President Obama to serve as Regional Director for HHS Region 4, which includes the states of Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. So Anton, thank you very much for joining us today. I've heard you speak before on many different presentations, and I'm really happy that you can be part of our webinar today. So I'll turn it over to you now.
Well, thank you so very much for that wonderful introduction. So happy to be here with you, happy to take the opportunity to talk about the health insurance marketplace, the work that we're doing here at the department, and how this is an incredible opportunity to create better options and better health for so many people in this country. So without any further ado, I'd like to go ahead and kind of jump right into it. So I'm hoping that you can see my screen in full,
yes,
and that there's no trouble here.
One thing, Anton, before you start, just to let people know, if you have questions during the presentation, we're going to take some questions right after Anton's presentation. So if you think of something, you can go ahead and type the question into the question box on your screen, and we'll go through those questions and answer them at the end of Anton's presentation. Thanks, Anton.
Great. So the first thing I wanted to talk about is just kind of give people a quick sense of our accomplishments thus far around implementing the Affordable Care Act. 95% of all of our regulations have been completed at this point in time. And so we are now putting the information technology into place and testing that technology to make sure that the marketplace works very well for consumers all across the country. So we also know that many states have made the decision about how they plan to implement the marketplace in their state. So the landscape is kind of set. So we know that some states will be running their own marketplaces for consumers. Other states will be in a partnership with HHS. And then we have about 26 states that we will be facilitating a marketplace there for those consumers. And so we know what the landscape looks like. We're ready to move forward. Now it's time to turn the page to focus on outreach and enrollment. So here's some key pieces of information that I wanted to provide for you all about what's happening in 2013. Earlier this year, in April, issuers, insurance companies in the state that plan to participate in the federal marketplace have submitted their qualified health plans, rating, and benefit data. So we now have that information in-house, reviewing it, preparing to put it all together for consumers to be able to shop during October. In addition to that, in 2013, we streamlined this single application and finalized that and provided it to everyone, particularly the states who are going to be working in the same regard. But I want to give people a sense of what this actually means. Normally, people that are shopping for insurance on the private market in current times and most current plans, they're filling out between 14 and 17 pages of information to see if they can qualify to purchase a health insurance plan from an individual insurer. When we first drafted our single streamlined application, it was at about 21 pages that we looked at, and we thought that we could do a lot better than making people fill out 21 pages of information. So we were actually able to get that single application down to 3 pages. So it's now a 3-page simplified application for consumers, and we started making that available for people to look at in April. In the beginning of June, excuse me, at the end of June, we relaunched healthcare.gov, and we also launched our call center. I'm going to talk a lot more about that in the next few slides, but I want to tell you that happened in June. So in August, we'll also begin training for in-person assistance for people who want to assist consumers in enrolling in the marketplace. We'll start that training in August. We also will have the web portal loaded and tested with the insurance company's information so people can start looking for qualified health plans. And of course, October 1st, 2013 is when the open enrollment period begins. So here's what I wanted to share with everyone. If you look on your screen here, you see actually the homepage of healthcare.gov. If you have not visited healthcare.gov, if you have not been to that website in the last 2 weeks, I encourage and implore everyone to go and visit and look at this new tremendous web portal, and where people will be able to get information about the health insurance marketplace, and then very soon we'll be able to use this same website to shop for coverage in all 50 states in the country. And so what do I mean by that, this new and improved website? This is a consumer-facing portal really focused on giving insurance the information that they need to make a decision to buy health insurance, and actually to help them to understand how the insurance marketplace will work going forward. So as you can see, this website is very friendly, very consumer-friendly, very open and facing. It's actually one of the most consumer-focused websites that I've ever seen a government agency produce. So it's a great place for you to gain information and get all of your questions answered about the marketplace. So we thank you so very much for being patient with us to see what this website will look like, and now we're excited about making it available to people so they can know what they get. Also, I'm showing you here, this is a mobile optimized version of healthcare.gov. What we were able to do by working very hard to get these things in line is that our website was designed with responsive design. That means if you open it on a tablet, if you open it on a mobile phone, the website will be responsive to whatever device and operating system that you open this up on, to make sure that you can see the information and is presented clearly for you to make heads or tails of what you're looking at. So this is a sample of what healthcare.gov looks like if you pulled it up on a mobile phone. Also, here's the thing that I wanted to mention is what we launched going forward. This is a very important piece, is that we have a 24-hour, 7-day-a-week call center that's available to answer questions, to provide information to consumers about the marketplace, about what's coming, what opportunities are coming for them. That phone number on your screen is an important phone number. So I'm encouraging everybody to write it down, take a picture of it, post it on your refrigerator, put it on your website, send it to your friends. 1-800-318-2596 is the phone number for our call center to answer questions for consumers. This call center is equipped to answer questions on all kinds of inquiries. So if you have a question around what's an insurance premium, or what's a deductible, or I already have insurance, will I be impacted by the health insurance marketplace, or where can I go to get additional information, and when will I need to make a decision about choosing a healthcare plan? This call center is live right now to answer questions, and we launched this call center in conjunction with healthcare.gov. Now, the most important point that I want to raise on this call, for everyone that is listening, this call center that is now 24 hours a day, 7 days a week, Yes, you can call at 2 a.m. in the morning and ask a question. Yes, you can get your answers question in Pacific time zones or in East Coast time zone. It doesn't matter. The most important thing is that this call center is in 150 different languages, meaning that questions can be answered and will be answered in the language of your choice that fits within that bandwidth of 150 different languages. That's a very important point to make sure that we reach consumers who don't just have English as their first language. Maybe it's their second language. Maybe English is their third language. But whatever their language is in their primary household, they'll be able to make a call to that call center and get their questions answered fully and completely in a language that is comfortable for them. And that's a very powerful tool that we have to have it in 150 different languages. So that call center is open now, June to September, to answer those kind of questions. But once we get beyond September, when we get into the open enrollment period that starts on October the 1st, this call center will help people to complete an enrollment application, determine their eligibility, and perform a plan comparison to help them to pick their choice and to find their insurance option that addresses their issues and provide all the information necessary there. So you can go from just getting information on this call center in June to actually directly enrolling in coverage during the open enrollment period that starts on October the 1st and concludes on March 31st of 2014. So here's a picture of what the Get Insurance landing page on healthcare.gov looks like. You can see it's very friendly, very open, beautiful images of families, mother and daughter on the front page to help them to answer questions and to fill out their application to see your plan choices and what you can qualify for. I'm going to scroll through a few slides so you can kind of see what the website will look like for people who are looking to apply. So if you can see right here, if you click on the Get Insurance tab and click the Begin process, it'll take you to a page where you'll get started to start your application. You got to talk about who you are and if you plan to apply for health insurance. So are you applying just for yourself? Are you applying for other family members or anyone of your same federal income tax return? Are you filing taxes for other family members and thus applying for coverage for them? So you get started right there. You click Next, and it takes you to the next screen. But this is where you will need to have information, your birth dates, your income information, your name, your social security numbers, all of those things that you will need if you plan to apply for coverage for anybody as you start this application process. So it'll take you through, you give your family your household information, your income information, provide other additional information, and then you'll review the application and then sign it. And then once you review and sign the application, it'll give you some results. So those results will tell you what you actually qualify for. Do you qualify for an advanced premium tax credit to help you to buy insurance? And if you do qualify for a tax credit, would you like to use that tax credit to buy insurance? Or do you qualify for a public program like Medicaid in your state? So based upon the information that you put in, you'll get your application results, and then it'll begin taking you through a process to begin registering for health insurance or purchasing health insurance. So the next slide will then take you there and say, listen, you're not enrolled yet. Here's your to-do list to enroll for coverage. You know, you need to set, if you qualify for a tax credit, you need to set what amount of credit do you want to apply towards purchasing your coverage. Then you'll set up your health plan. You'll pick up the things that you want to have on a health plan. You'll have that shopping experience. And then you'll select a plan, and then you review that plan and then sign. So I want to show you a little bit of those slides just to give you a sense of what that looked like. Now I'm going to go back to the call center and make sure I clearly share with you that we're trying to drive a positive consumer, customer-focused experience with the call center as well as the website. But now I want to talk about the call center. So we want to basically clearly communicate to everyone the places that they can go to get help. Again, you can go online 24/7, do an application online at healthcare.gov. If you get stuck or you need some help on that website, there's a 24-hour, 7-day-a-week web chat that's also available for you online. So maybe you don't want to talk to someone on the phone, and maybe you want to do it through web chat. You have the ability to do that. We also have text alerts and reminders available to people 24/7. And when you go to healthcare.gov and sign up, you can actually sign up for text messages alerts to be provided information. Of course, we're providing written applications that are in English and Spanish and notices and letters to people to make sure they're available, made available of everything. And then, of course, the call center, as I mentioned, 24 hours a day, 7 days a week, and we're providing support for 150 different languages. In addition to that, in many states around the country, there will be navigators and in-person assisters to help people to enroll in coverage. And so these are people whose job it will be to help you to understand the process and focus on enrolling in coverage. In addition to that, we like to make people aware that we're training 300,000 agents and insurance brokers to help people to answer questions and actually enroll in coverage. So as you can see, we're trying to build an operational experience that makes it easy, coordinated, focused to answer questions across all channels and provide multiple entry points for people as they look to enroll into the marketplace. So here's a quick snapshot of some of the folks that we know we have to reach with the marketplace information. 41 million people who are uninsured and eligible for the marketplace. There are about 28 million individuals who are eligible and uninsured in those federally facilitated states and the partnership states. There are about 18 states who make the decision to run their own marketplace, and we're well aware of that, but we're also well aware that we need to communicate at a national level, at a state level, and a community level at the same time. We know that 3.8 million rely on Spanish, and more than 1 million more rely on some other language for their primary information. 20% of the target audience has not graduated from high school, and they all are in a variety of poverty levels. We know that some 90% of the people that are eligible for the marketplace subsidies are under 400% of poverty. We also know that the young and uninsured are the most unlikely to have insurance and the most likely to not see the need for it. So we have to communicate to the young and healthy segment and demographic about why they need coverage and make sure this option is available to them. So there's about 17 million 18 to 35-year-olds that we need to reach. 58% of that audience is male, 42% is female, 26% Latino, and 18% African American. So we know that older folks, folks who are sicker, who are worried, that need coverage, they're going to find the marketplace. But how do we make sure this young and healthy demographic also gets engaged and find the marketplace? That's the national snapshot of the folks that we know that we need to serve and we need to reach. So here's something I want to share with you, is that we're also not just going to have navigators and a call center and a website to reach people, but we will also be developing and engaging in a digital campaign to reach people. So we will have, as you see here, widgets and banners and posters, many different pieces of information that can be used digitally on a website and scrolling across a news feed of some sort. This is all kinds of information that is made available. This is also being made available to our partner organizations, people who want to work with us and want to help us champion coverage opportunities for the millions of Americans who need it. This information is available to you, that we'd be happy to help you to get a widget for your website or give you something, a button to put into your email as you send out emails to your list and to organizations that you work with. So we want to make digital content available for as many people as possible. In addition to that, for other partners, we want you to be able to get other resources to help people apply and enroll and get coverage in the coming marketplace year. You can do that by going to marketplace.cms.gov. This is a great place for our partner organizations to explore, research information, get official tools to help you to communicate about the health insurance marketplace, to help you to get the message points on how we're communicating with the American public about the marketplace. And so this is all available at marketplace.cms.gov. I wanted to show some samples of some of the publications that we're making available to our partners. As you can see, we want to have brochures available about the health insurance marketplace, about the value of health insurance, about the Small Business Health Options Program to let small business owners understand and know what they need to do to help take advantage of the marketplace. We also have fact sheets and checklists to help people to get ready for the marketplace. What do you need to know that if you're going to look for health insurance coverage in the health insurance marketplace? You need your Social Security numbers, you need your birth dates, you need your W-2 forms or wage and tax statements, and any policy numbers for any coverage that you have. So these are things that we're putting in our fact sheets that we want to make available to our partners to download right from our website, to print them out, put them in your lobbies, your waiting rooms. You can even repurpose this information and send it out to your list. If you wanted to do a special electronic communication with your list around what do you need to know to get ready to apply for the marketplace. So fact sheets, brochures, checklists are all being made available. We also have posters and postcards. As you see here, these are ways that things that you can put up to talk to people about the marketplace and explain to people what they need. Do you need health insurance? Do you know that new coverage options are available to you? Sign up at healthcare.gov. Visit healthcare.gov. Learn more on how you can get ready. And then also making resources available to people. We also, again, as I mentioned, have badges and widgets that ask simple questions. Learn more about the marketplace. Get answers to your questions. Do you own a small business? Do you run a small business? Are you interested in coverage for your small business? All of these badges and widgets are being made available to many of our partners, and we'll be happy to share this information with all of you. So as you can see, here's some text information that we're also making available. We know that people communicate in a 21st century way in the 21st century, so making text messages available with the appropriate information about the marketplace is what we're trying to share. So we want to let people know that these things are available to them. We also have other stakeholder materials. So if you want to do fact sheets that are particular to your group, if you want to have posters put out to announce that you're going to do an event to educate people about the marketplace, we have all kinds of stakeholder materials that are available to you on our website, again, marketplace.cms.gov. So again, a fillable flyer event, if you want to host an event, you can have a pre-made flyer for that where you can just fill in your information and direct people to how they can get information from you about the marketplace. And then we have infographics that we're making available on healthcare.gov that we want to make available in lots of other places that explain to people how the marketplace works. It's a very useful tool. Infographics is a great way to explain people complex information, and we found a way to simplify this as much as possible by providing it here. So we also have YouTube videos. You can go to youtube.com/healthcare.gov and get video testimonials about people who've gotten coverage, or a video that explains to you how you will be shopping in the marketplace come October. So all of these things have been made available for people to you. I also want to share quickly, we have information in English and in Spanish. We're making it available in other languages as well to make it available for people to be able to use. You can see in this document, I don't know if you can see, but there's multiple languages here listed on this document to get these messages available in English and Spanish as well as many other languages. We also have radio PSAs that we've designed. So one called Better Options, Better Health. And if you want to put together a PSA that speaks particularly to your constituency, groups that you work with in your community, you'll be able to get a radio PSA drafted by us with the appropriate information. We also, again, have multi-purpose text messages. What are we talking about this summer? Getting people prepared for the marketplace. But then we have different messages once we reach October to explain to people that open enrollment is here. You also see images on the right-hand side of your screen that messages could go on receipts at businesses like CVS, and other businesses that you can explain to people that there's a new health insurance marketplaces and let them know where they can go to apply for coverage. So we also have a limited number of quantities of materials that can be ordered at no charge to organizations who are doing outreach on the marketplace. If you want to place an order, you have to go to our product ordering website and create an account, fill out the required fields, and once we approve your account in about 3 days, you can browse and order some products to receive email notifications of other opportunities to pre-order new products. That website is productordering.cms.gov. Again, productordering.cms.gov. And with that, I'm going to go ahead. I know we're running short on time, but I wanted to get to the last slide and make sure everybody understands this is what you can do to help us more than anything else. You can help us by raising awareness around the marketplace and what's coming. You can do activities around the launch and the relaunch of healthcare.gov. Make sure people are familiar with this website. And also, you can have members participate in educational webinars, such as the one we're doing today, and then help them to educate others by doing the same. You can share our information via digital, social, and earned media, paid media channels, so we can really get this out there to people. And the second thing you can do to help us is to support our enrollment efforts. We have an opportunity to train persons as assisters to help people to enroll in the marketplace. We're very happy to have organizations who want to be partners with us to have their staff members, their volunteers, certified as application counselors to help people through the application process to enroll in coverage. Or you could also provide space for enrollment or help us to host enrollment events where there are opportunities for people to actually sign up for coverage. So these are the things that we've made available to the marketplace thanks to our work on healthcare.gov, and we're very happy to have you all on the phone today and looking forward to having more partners. So with that, I'll be happy to take some questions.
All right, thank you very much, Anton, for all that information that HHS and all the work that HHS is doing. At this time, I'd ask individuals, if you have questions, please type them into your question box on the screen, and we can read them and have Anton see if he can answer some questions. One question that's come up, Anton, for the consumer publications, I know there's various things that are out that you mentioned. What different languages are they available in, and how can people get those? You mentioned about ordering materials. What languages are available for people to order materials in?
So right now, the materials are being made available in 15 different languages. I don't have that list of languages in front of me, but again, you can get a sense that we're starting at 15 and looking to grow that to more languages. All of our information, all of the questions can be answered verbally, of course, supported through the call center in 150 different languages. But right now, we have 15 available. And I'm happy to make sure that we get back after this call a full list to you and all of the groups, the 15 languages that we have most of our stuff made available in now, and then provide that fully to you. And of course, we'll let you know as more languages come online.
Great, that would be great. Another question concerning the call center. You said there are 150 languages available. Can you talk more about how the language services work? Is it through a language line? Are there actual people that speak the different languages in the call centers? Could you talk a little bit more about the call center language services, language access?
That's a great question. What I've learned from my colleagues at CMS is that we have done a yeoman's job of trying to make sure that the wait time for people to get their questions answered is being shrunken down to less than 2 minutes, and they actually get to someone who can speak to them in the language of their choice. And so I think we're operating this call center robustly ourselves, so you won't be transferred out to another organization or another group to do the language translation, but making sure that we have customer service representatives who can manage the diversity of those languages right there at that one call number.
Great, thank you. Another question, would it be cost effective to translate the application in more languages instead of the translators to support each application? So I guess the question on the translation of the application itself.
The application, that's a great question. I mean, one of the things that I know that everyone here is trying to do is to figure out how to try to be more efficient in making sure that we connect the dots in the right ways. And so we know that the application itself will be translated into a few languages, but it's not as robust as we want it to be and what we know other folks to be. and we're trying to use as much of our resources as we can to do it efficiently and effectively for people. So I don't have a great answer as to whether or not it's more cost-effective or cost-efficient. To some degree, we have, we have a huge job in a limited amount of time to make sure that we're ready and get things prepared. So some of this, what you see today or what you see on October 1 may not be exactly what you see on December 31st or even March 31st, because we have the beautiful thing about this process of having a 6-month open enrollment period is to try to improve upon the progress, the tremendous progress that we're making to make sure that we can make more materials available in more languages and in more efficient ways to make sure that we get people enrolled in coverage. And so that's what we're working towards now. I did just get a quick update to let you know that we will have it, the 15 languages that I talked about, the materials will be available in. Chinese is one, Korean is another one, Vietnamese is the third. It's also in Polish, Russian, Portuguese, Creole, Arabic. So there are many different languages that we are trying to make it available for, and we're going to continue to move forward to try to add more to that mix.
All right, great. Thank you very much. Just a couple more questions here. What happens if a person an LEP consumer is not satisfied with the call center operator in providing their in-language information? Is there a way that they can go to address that if they're not satisfied with the language assistance that they're getting through the call center?
So I don't have a firm answer to that question, but I will tell you this, is that what, again, as I mentioned earlier, we're trying to be as responsive as possible to all inquiries, all concerns that we have with the call center, as well as the website. So for instance, if you go to the website and you cannot get information that answers your questions or suits your needs, we have an immediate feedback loop right on the website, right in the particular area in which you're looking for information. We ask a question at the end: are you satisfied with the information that you received? And if you have not, you can put in what you're not satisfied with, even type it in right into a text paragraph, and that'll get right to our analytics team. And we're making real-time changes. So if we see that information is being asked for specifically by large numbers of people and it's not already listed on the website, we're going to make those changes and move that to the front and have those answers. And so the call center, the intent of the call center is the exact same way, that if someone is not satisfied, we want to make sure we have a feedback loop, an active feedback loop, to make sure that we get feedback in that process, and they can do that right through the call center.
All right, great. Well, one final question. If a particular language is not available and there's an organization that would like to translate materials in that language that is maybe used quite a bit by their community, what steps do they need to take in order to do that?
We're very happy to have them to do that. We can just connect them with CMS. So again, if you go to marketplace.cms.gov and sign up on our list, there's an email address there that you can make that inquiry if you would love to provide those services and help us to provide that assistance. We'd be happy to take that support by connecting them with our CMS team, who can help get them the materials that they would need to have in order to be translated.
Okay, great. Thank you very much. If you have any additional questions, you can go ahead and type them in, and we can have them addressed later. At this time, thank you very much, Anton, for that presentation. Really appreciate all the information you've shared. Our next speaker is going to be Quincy Nguyen from Community Catalyst. And Quincy is the Program and Policy Associate at Community Catalyst, also the leader of the Health Equity team. She's got a lot of research, doing policy research analysis on a variety of issues, including poverty reduction, child protection, human trafficking in Southeast Asia, as well as issues of health and health acts in the United States. So Quincy, I'm going to turn it over to you, and she's going to speak about some of the roles of consumer advocates and also some of the consumer assistance programs available.
Thank you, Ian. Good afternoon, everyone. Thank you for having me today. So let me give you a quick overview of who we are. So Community Catalyst is a national health advocacy organization based in Boston. We work to ensure everyone has equal access to high-quality, affordable health care we provide support to state and local consumer advocates, state policymakers, and foundations to build consumer advocacy networks in more than 40 states. So for the next 15 minutes, I would like to give you an overview of the timeline for the Affordable Care Act. So just like repeat what Anton already mentioned, and also talk about the opportunity we have in terms of consumer assistance and next step for advocates. Next slide, please. One more slide. So as you already know, open enrollment start on October 1st this year. Insurance reform, tax credit, Medicaid expansion start on January 1st, 2014. And state and federal government as well as consumer advocates have begun to think about creating infrastructure to sustain enrollment and retention in future years. Next slide, please. However, in reality, few people understand the ACA. So according to the Kaiser Health Tracking Poll in April 2013, 4 in 10 Americans are unaware that the ACA is still the law of the land. About half of the public say that they do not have enough information about the health reform law to understand how it will impact their own family. As Anton already said, we have nationwide. We have 17 states declare state-based exchange. 7 states are planning for partnership exchange, and 27 states will have federal facilitated exchange. And who will enroll through exchanges? So we have like a lot of new people will enroll in exchanges will be more racially diverse than those who are currently have private insurance right now. And 1 in 4 exchange enrollees will speak a language other than English at home. Given the characteristic of the newly eligible population, it is important that people who assist the new enrollee to understand how premium tax credit work and their impact on family finances, and explain how health insurance benefits, cost sharing, and appeal processes work. So next slide, please. So for the next few minutes, I will talk about the priority for consumer assistance. So it is important that people who assist consumers to enroll in coverage need to be independent, culturally competent, and trusted by community. They must provide clear and correct information and provide information that can be understood for those who don't speak English well. And the ACA initial success will be judged by enrollment numbers, but it is very confusing to navigate the complex system, health insurance system. So the next slide, please. One more. So the ACA provides 3 types of consumer assistance tools to help enroll people. So the first is navigators. So navigators serve people enrolling through exchanges, but may provide service and referrals for public coverage. Their major duties is to educate consumers on healthcare options and assist people with eligibility, enrollment, and plan selection. Community-based organization can be a navigator or union, chamber of commerce, or professional association or broker. But they must be culturally competent and they cannot receive payment from insurance companies. So who fund navigators? First, exchange must create navigator grant programs. So for the state exchange, funding is from the state. So for 14 states have already set up the navigator program. So like for example, Maryland announced like $24 million award to set up the navigator program to enroll 654,000 uninsured people. And in New York, about $27.2 million will be available per year for a period of 5 years for the navigator program to help enroll about 2.5 million uninsured. For the federal and partnership exchange, funding will be from HSS, and HSS will provide training for navigators. State can decide to do further training, but they should coordinate with HSS. 34 federal exchange and partnership state exchange will receive in total $54 million navigator grants. The minimum amount any state may receive from the funding is $600,000. States with greater uninsured population can receive more funding. For example, Florida will receive $5.8 million navigator grant to enroll 3.5 million uninsured, while New Hampshire will receive about $600,000 to enroll 123,000 uninsured. So you can see there's a big difference between funding from the state and federal. The second type of assistant is in-person assistant. So similar to navigator, in-person assistants have the same duties and follow the same conflict of interest rules. State can design in-person assistant program and can choose any groups to become assistants. For state-based and consumer assistant partnership exchanges, states are allowed to use federal exchange grant money to fund in-person assistants. A number of states, for example, California, Connecticut, Washington have designed or released request proposal for assistant program, and there is no funding available for federal exchanges. And the third program is Certified Application Counselor. Next slide, please. Certified Application Counselor will help people understand and choose coverage options and help fill out the application. They also conduct outreach and education and provide cultural competence information. Currently, it's not clear who will serve in this role. The key difference between Certified Application Counselor and Navigator and assistant is that there is no funding mechanism for Certified Application Counselors. So although it is unclear who will serve in this role, but community-based organization and healthcare providers can play this role. Next slide, please. So what is your next step? As we already mentioned several times that open enrollment starts in October, so we need to develop a plan and start education and outreach now. So you can let people know about the coverage option through, for example, organizing community events, health fair, canvassing, handout materials, and while organizing on outreach, it is important that you collect problems and fit it, give it back, provide it back to policymaker to improve the policy, and highlight success stories. And next slide, please. You can also become a navigator or partner with navigator entities. So at Community Catalyst, we are tracking who navigators are in state. So if you need connection, please let us know, and then we will connect you or give you information about them. So there is going to be a lot of work for all of us. So we should work together in this effort. Next slide, please. And next. So in the last few minutes, I would like to share with you 2 success stories from our partners in New Mexico and Maryland. Next slide. So in New Mexico, Health Action New Mexico partnered with local musicians to organize cultural learning events called It's a New Day for Healthcare in New Mexico. So those events are advertised on radio. It's because many rural communities still do not have broadband internet, so it's really important that you choose the right media to reach people. And they track questions that arise at these community meetings so that they can share back to with the assister as and then feed it back to the policymaker. And all the materials are very simple and in English and Spanish. And the second story is from Maryland. So Maryland Citizen Health Initiative trained member of churches to become health ambassadors to help educate people about the ACA. So the key element of the ambassador is that many of them are willing to share their own story. And these stories are very similar to the stories from community members. So the program is really successful and it's expanding beyond Baltimore City and have very strong partnership with other churches in different regions. Next slide. And next slide. So the following are useful tips that we collected from our partners when they do the outreach and education. So it's really important that when you produce materials or you give a presentation, you should avoid policy jargon. And if you can translate the material into different languages, please do so. And when you talk to people in the community, the starting point is to talk about their health issues, their concern, and use it as an entry point to talk about the ACA and how the ACA can benefit them. And the material, you can break it down into different groups. For example, you create materials for women, for people with disabilities, for Asians, so that you can modify the information that resonates to a different community. And organize events in the community and encourage people to attend. Some people are very busy, so you should choose the time that they are at home, like for example after hours, and provide meals or child care for people. And at the end of the meeting, you should develop next steps so that people can have the information back and and have a plan for the next activities. We are here as a resources, so if you need more information, please feel free to contact us on my email and Christine Barber email at the end of the presentation. Please feel free to email us anytime.
Okay, thank you very much, Quincy. If you have any, thank you for that presentation on the different types of consumer assistance available. Are there any questions for Quincy at this time? If you have any questions, please type them into your question box. And thank you, Quincy, especially for sharing some of those stories from the different states. I think it's really important for us to hear what's happening in different states and learn from each other in ways that we can do consumer assistance and learn from the different types of strategies that different people are engaging in. Okay, at this time what I'm going to do is keep moving along is Andrea, is Andrea back yet? I'm going to go ahead and talk about some of the barriers and challenges, and then maybe after that Andrea can come back and talk about the community health center role. So let me go ahead to my piece here. My name is Ian John. I'm the policy analyst here at the Asian and Pacific Islander American Health Forum, and I just wanted to kind of highlight some of the different challenges and barriers for the Asian American and Native Hawaiian Pacific Islander population. And I know that most of you are familiar with these, but I think we need to really think about these things, especially as we get ready for our meeting next week in Connecticut. I think it will guide a lot of our discussions as we move forward and plan our national strategy. So in all of our presentations, I always put our mission up. The mission of the Asian and Pacific Islander American Health Forum is to influence policy, mobilize communities, strengthen programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. And for those of you who are not familiar with our organization, we are headquartered in San Francisco with a policy office in Washington, D.C. And we've been doing this work for over 25 years. Just to share some statistics, I'm sure a lot of you are familiar with these numbers, but I just wanted to share some of the numbers so we know what populations we're trying to help here. For the uninsured population in the U.S., it's about 15% of Asian Americans, 2.8 million Asian Americans, and about 162,000 Native Hawaiians and Pacific Islanders. It's estimated that 2 million Asian Americans who would otherwise be uninsured will gain or be eligible for coverage under the ACA by 2016. And when we look at these numbers, we say 15% of Asian Americans, you know, the general uninsured population of the U.S. is probably also around 15%. But I think especially for the Asian American Pacific Islander population, we know that there are so many different subgroups that these numbers are different based on the racial ethnic subgroups that we represent. So I'm going to talk about some of the key barriers here, 3 key barriers. One is language access. Second, I'm going to talk about some of the immigration status issues around the Affordable Care Act, and also small business ownership. We know that many individuals in our communities are small business owners, and so I'm going to talk about these 3 things as we move forward here. Language access. We touched on some of this in Anton's presentation about the different language access features of the marketplace. We know that 9 million people speak Asian and Pacific Islander languages at home, but more than 4 million are considered to be limited English proficient, which means they speak English less than very well. And we also know that there's a large number of children under age 19 who live in households where there's at least one LEP parent. And so all of these things present challenges in accessing the new health insurance marketplace. We know that 25% of individuals purchasing on the marketplace will speak a language other than English. And again, this is just to emphasize the point that depending on which group we're talking about, there's a lot of differences in terms of LEP in the different subgroups. So we see that some of the Asian American subgroups are much higher in terms of their LEP population. You see some of these groups in the 40s and 50%. And so when we're doing our outreach, enrollment, education, we really need to understand which specific groups we're targeting and what their needs are in terms of language access for the marketplace. For immigration status, this is something that can be, there's all kinds of different complex eligibility rules that apply. And we want to make sure that, especially for mixed status families, family members can access the insurance marketplace because different members may be eligible for different types of health care coverage. If there's a child in the family, they would be eligible for CHIP. If there's an undocumented parent, as we know, those individuals are excluded from both the health insurance marketplace and Medicaid as well. And then there's different eligibility categories for various lawfully present residents, depending on the state that they live in as well. And I've put up this table here just to give you an idea of some of the different categories of immigration status and who is eligible for what. So we see that for ACA, for the subsidized insurance, almost all of these groups are eligible with an exception to the undocumented immigrants, as I mentioned before. They're not eligible for the marketplace or Medicaid or for CHIP. And you see, depending on what state you're in as well, we know that lawfully present adults, we're all aware of the 5-year bar in some states where they're not eligible to receive coverage, Medicaid coverage, whereas some states have decided to cover that population. So I think the point I want to make here is that we need to be mindful of all these different groups as we're doing our outreach and enrollment. Another concern that a lot of immigrants have are fears about their immigration status. So if they're in the process of becoming a citizen or in the process of getting their residency, there's all kinds of things that people are very sensitive about. And we want to make sure that this does not prevent other members in the family from getting enrolled and covered. So, individuals may be reluctant to provide necessary information that would be to determine their eligibility for the health insurance marketplace or for Medicaid. And we want to make sure that in all the outreach that we do and in the materials that are provided, that especially for mixed status families, people are not scared that their information is going to be used against them, and they want to make sure that they get family members who are eligible to enroll, because we don't want to see. We know that there are a lot of these families out there with mixed status, and we want to make sure that as many people can get enrolled as possible, and we want to make sure that people are not turned away from helping apply for other members in their family. I'll talk very briefly about the small business piece here. Asian Americans represent over 1.5 million minority-owned businesses in the U.S., and many of them are sole proprietorships and family businesses. And we know that this is a big challenge because under the ACA, certain businesses can get tax credits, but if you're a sole proprietorship or a family business with no paid employees, then you're not eligible to get the tax credits. And as we have been involved in doing a study of focus groups throughout California, talking to Asian American and Pacific Islander small business owners about their impressions of the Affordable Care Act, what their barriers are to getting coverage, and we've heard we've gotten a lot of feedback and learned a lot, and we know that a lot of people are still confused about the Affordable Care Act and what they're required to do. Many small business employers, one of the first things that they said was, the ACA means that we have to provide insurance to our employees, and we know that that is not the case for small businesses. And even now, recently, with the recent announcement, in the first year, no employers are required to provide insurance for the first year of until 2015. And so I think being mindful of these misconceptions is very important as we go about our outreach and enrollment. And just to give you an idea of, what the population that we're serving, a lot of them are both uninsured and are also small business owners. So you can see this graph here. I've selected different groups where they have different subgroups who have at least 10% or more small business ownership in the United States. And I've also put the rate of uninsurance next to that. So you see that this is really a big issue for the small business community. Many of them are uninsured. Many employees as well who work for small businesses are uninsured, and we want to make sure that they have the ability to access the health insurance marketplace, and that small business owners also have an incentive to provide insurance to their employees and know about the tax credits that are available, whether they're eligible or not. And we've heard a lot from the research from our focus group findings is that it's all about cost. They want to know, what is this actually going to cost for me? Even if I'm eligible for tax credits, what does that mean in terms of cost? Can I still afford to provide insurance for my employees? And for employees as well, it comes down to cost. Am I eligible for Medicaid? Am I eligible for the marketplace? How much money am I actually going to be given help with? How much is my subsidy going to be, and how much will my monthly premium be? So helping individuals with all of these things, I think, is going to be very important moving forward over the next several months as we focus on our outreach, education, and enrollment. And with that, if you have any questions, please type them into your box, or you can email me directly. I've put my email address there on the screen. Let's see if we have any questions. If not, at this time, I'm going to continue on to our next presentation. Andrea, are you back yet?
Yes, I'm here.
Okay. So I'm going to pull up your piece here, and let me just do a brief introduction for Andrea before we keep moving on. Dr. Andrea Karakostas is the current Executive Director of the Hope Clinic, which is a federally qualified health center providing care to a large multicultural community in Southwest Houston. She has a long record of dedication to special populations and to community health center work. She has 10 years experience working with community and migrant health centers and special populations, and she is also a board member of the Texas Association of Community Health Centers and the Houston Partners for Community Health. And with that, Andrea, I'd like you to, if you can go ahead, and we'll listen to your presentation on the role of the community health centers.
Okay, so can we have the first slide? Okay, so this is very timely. So today, the federal government, HRSA, the Health Human Resource Service Administration, announced the grants for supplement support for outreach and enrollment. So very, very timely webinar. So $150 million were distributed to the different health centers to hire additional staff to conduct outreach and enrollment for this program. And this is a one-year grant. So and its purpose is really to increase the number of people signing up on this program. So next slide, please. So community health centers are expected to really play an active and visible role in the community outreach. We are, for those of you who've done outreach and education, you know that it's a very expensive task, and it requires a lot of coordination and activity within the community. So, of course, we are expected to reach the patients that we already serve, but we're also expected to reach people within our service areas. This is particularly hard for community health centers that serve large multicultural communities, like Hope Clinic, for example. So this funded positions and health centers have been giving funds according to the number of people they serve. So Hope Clinics, being a new health center, we have about 18,000 patients. We're giving enough money to fund 2 positions. So the larger the health center, the bigger the pot, and the larger the reach. We're expected to educate everybody about their coverage options and help set a marketplace portal and provide education to everybody, and do, of course, the eligibility determination on site or through partners. But I want to talk a little bit in the specific, not about what the federal expectations are, but actually what happens on the ground, and that would be the next slide. So, as healthcare outreach really is a very, in my opinion, is a very integrated community community model. So, I don't think health centers can be expected to reach their community without the assistance of other community members. It is important for health centers and other people doing outreach and trying to enroll people in this program to go out with one message. So I definitely think that training will be a key factor in the efficiency and effectiveness of this program. Having a standard methodology on how to enroll people into the program is critical as well. So again, training and effective reach, making sure that we are mapping our communities, knowing where to reach first, where to go first, where to dedicate the most of our resources in an effective way. And the other part that is very important is the outreach infrastructure. How are you going to do this? What type of systems are you going to do this? What type of materials? So while there are educational materials out there, being able to manage those materials correctly is very important. How is the outreach worker that you are going to hire with this fund be most effectively used? Is it going to be really with direct patient care, or are you going to train the trainer and reach other members in your community so they can help you do the true work and the true reach? Integration with other healthcare systems, timely and appropriate access to care really is the bottom line of this program, right? The Affordable Care Act is not there just to enroll people in insurances and make sure they have a card in their wallet. Really, it is to increase care, provide more preventive care, reduce overall health care costs through preventive care. So I think that needs to be a very clear message, and it's not just making sure that people comply with the law. The bottom line is that we need to reduce costs in healthcare, and that can only be done through prevention, and that needs to be an integral, and that only happens with integrating your outreach activities with whichever healthcare providers you have in your area. The last thing is the workforce development. HRSA and the federal government, I'm sure our own organizations, we also expect to keep these outreach workers for the long run, because this is not a one-time thing that you hire someone and then you let them go. Health of people are also determined by the amount of working opportunities that you have in your community, and the amount of the excellent practices and promising strategies that you can develop to be able to outreach and educate people in other areas. As the Healthcare Act progresses and we enroll people, these people are going to be expected also to learn about the healthcare systems, how to access them, how to use them efficiently and effectively. And of course, then we'll have to dedicate more efforts into identifying what the disparities in the areas are and educating people about how to gap those disparities. So I think that this program opens the doors to a larger scheme of problems just merely than merely helping people get enrolled in a healthcare insurance plan. Next slide, please. Next, okay, thank you. So this is a little slide about what happens in the front line, and again, I want to underscore the need of having cost-effective care and high quality of care, and using this
opportunity to educate people about the marketplace and insurance, to make sure that they understand how important it is to have a health care home and how to partner with your local organizations to effectively manage chronic illnesses, improve outcomes, and keep those outreach workers. Most of the community health centers have really strong partners in the community. In the case of Hope Clinic, one of the strategies we use is making sure that we train all our partners and we share the resources we have with them. So for our HRSA grant, for this HRSA outreach grant that we just applied for and got, we really proposed not only having 2 positions for the clinic, but in addition to that, having some funds to train the 16 other partner organizations that Hope Clinic relies on to reach the hard-to-reach populations that speak languages that no other group will probably be able to provide education in, and give them the tools and the capacity they need to be able to effectively educate them about the options and use all the tools and materials that have been described in the previous presentations. So that, in a nutshell, is a little bit of the role of the community health centers and the way, in the particular way in which Hope Clinic views its relationship and its partnering with all the other organizations. I think the basic message is we're very grateful to the federal government for this opportunity, but we can't do this alone. And this program is not going to be successful unless we partner with other organizations and we have the necessary partners to be able to reach those populations with language barriers. And that's all. One more slide. We have more slides, I think. So here's that message. We're only as strong as our partners. And the importance of really having one message, one voice. Thank you.
All right, thank you very much, Andrea. Any questions? For those, if you have questions, please type them into your question box. And as we're getting ready to wrap up here, I just wanted to identify, so next week, I know a lot of you are going to be in Connecticut for our meeting on Monday and Tuesday, and there's a couple of things that we'd like you to think about before coming to the meeting. So I've put up on the screen here some of the things we want you to think about and have ready to discuss on the first day of our meeting in Connecticut. First, identify the 2 most important things that you learned today. So if there's, whatever you learned from the presentation, the 2 most important things you learned. Second, identify at least 3 resources, potential partners, opportunities in your state for outreach, education, and enrollment. And third, identify 3 key issues or areas of concern that you see in your state when you think about outreach and education and enrollment, specific to the communities that you serve. So 3 key issues or areas of concern that you'd like to bring to the meeting on Monday. Finally, if you can do an estimate of the number of people that you think you can reach. So what we want to try to do is when everyone comes to the meeting next week, get an estimate of what our reach can be together as a group. So if you can estimate what you think the number of people you can reach will be. A couple of questions are coming in. Andrea, what are some unique issues that community health centers might experience trying to provide assistance to LEP AAPI patients?
I think one of the things that people need to be very thoughtful about is the way and the strategies one thinks to outreach. We need to be very mindful of the difference in cultural innuendos and preferences of the different groups. So I think, for example, we have been very successful using the media to reach our Chinese population, and very successful using the radio to reach our Vietnamese population. Very unsuccessful reaching the Hispanic population with those two media. So we have learned a lesson on outreach and enrollment in terms of the preferences of the different groups. So hosting a focus group, understanding what are the best ways to reaching them in addition to their needs is critical.
Yeah, I think that's a great point that you made. That's something we also learned from our focus groups with small business owners. Some certain groups, preferred outreach in ethnic media, ethnic newspapers, TV stations, whereas others, younger generation, felt the website was the best way to do outreach and education. So I think that's very important as we identify the different populations that we're serving. There's some questions about the slides for today. So this webinar has been recorded, and you will be sent a link for the presentation as well, so you can view it again with the slides and the audio. If there are any other questions that you'd like to pose, you can email me. I put my email address there. If you think of something that you want to discuss or send a question to me, I can put that to the correct person if you have a question for somebody specific. Also, be prepared next week. Bring all your questions, and we'll hope we'll have a great discussion there. So thank you, everyone, for taking the time to participate today. Have a good day, and we'll see you all next week in Hartford. Thank you very much.
Bye.
Thank you.
Bye-bye.